such a pleasure to be here with you all today and to be in conversation with a dear friend, longtime colleague, also who has, I think both of us have been at the best of mayors and local leaders who have put a tremendous amount of pressure on us to get the right data and to be responsive in a number of ways. So we're excited to be in this conversation with you all. So at Bloomberg Philanthropies, you've heard so much about what we believe here around local leaders having access to the right data in order to empower evidence-based decisions. And in the work that we're leading at Bloomberg Philanthropies with the Greenwood initiative, we have made an investment, as was mentioned, in data disaggregated by race at the Black Wealth Data Center. This is a tool for U.S. data and specifically in response to the racial wealth gap here in this country. Beth has been a partner in that work, but we want to raise up for just 2 seconds. Beth, I'd love to hear from you as a data expert. Why is this conversation around practical use of data at the local level so important?
And this is the conversation that we've been having since we started this whole entire effort yesterday. And so I'm going to go back a little bit to our conversation and re-anchor us in why we became public servants, why we joined public service, what it is that we want our enduring legacy to be. And the fact of the matter is that we have to use data all the time to figure out whether or not our legislative policy making is actually having a good effect in our communities, whether or not our budgeting is having a good effect across our programs and in our communities, with all of our decision making anchored in evidence and this practice of, are we reaching the right populations? Are we moving the needle in the right areas? Are the things I care most about, whether that's a reduction in crime, less hungry kids, more access to education, water infrastructure, whatever that may be, we need to make sure that our decision making is actually moving the needle. And without data and without a robust citywide data strategy, you're not getting there. And so this discussion is really about how you can do that and not just do that at a scaled up level where you are capturing a very broad understanding, but really getting a deeper understanding so you know whether or not those efforts are actually having an effect across the board for everyone instead of just at the top for the low-hanging fruit.
And Beth, what you are describing are themes that we've heard in the last couple of days as well as throughout this program. But there is that natural tension of data that is in service of everyone. And part of that is having disaggregated data by race. Could you talk more about why that component in particular, no matter where you are, is really critical?
So this is a capability challenge, right? We talked a little bit in Dr. Linos' session around skills and being able to hire the right kind of people. And this is about making sure that those people know how to answer the right kinds of questions. And you can collect data on the health of a community, and your metrics could tell you that a particular area is actually quite healthy. But if you're not disaggregating that data by age, by race, by gender, then what ends up happening is you may be obscuring the fact that there's a pocket of that population that isn't doing well, where chronic disease is taken hold, and there's an intergenerational passing of those chronic diseases because of things like their houses are poisoning them with lead paint, or because their water infrastructure isn't intact, or because we've undercapitalized on green space in communities that are particularly vulnerable. And if we're not being really refined about the way that we take our data, that we ask questions of our programs, the way we think about the way that we sort of think about all of the solutioning we do as public leaders, we're going to obscure the realities of living in our communities. And so we think about disaggregation as our ability just to fundamentally understand the real realities of living in communities.
But is it also, though, which is what we found as we asked this question of how do we think about wealth, is it also not only the disaggregation of data, but looking at issues that are interconnected? Because what you presented, even in the use cases, you may start out thinking about housing, but we're also talking about health. We're also talking about economics. There are many things that need to sort of play together to help us identify both the problems and come up with the solutions.
Yeah, I mean, I think that interconnectedness is everywhere. I think about healthy housing all the time because, we know Baltimore is a city that now, going on 4 decades is trying to eradicate lead paint poisoning in children. But what are the measures that we look at to see whether or not we're being effective? We look at a lot of measures. We look at school attendance. We look at ER admissions for asthma. We look at the housing stock. We look at the construction materials. These are all disparate data sets that live across an entire ecosystem of public organizations that if you can't access them in one place, you're never going to get that full picture of whether or not all of the leading strategies for eradicating some of the real ills of the way that we have handled policymaking can yield. And so the interconnectedness and the idea that this is an enterprise skill set that we need to think about from an enterprise perspective is critically important.
Isn't it also, though, that mayors need cases? They need case making, and the data helps make the case on why they would focus some of the energy, some of the programs on one community versus the other, because they are in service to all, they're in leadership to all, and have the responsibility of responding to all of their citizens. But there are some groups that are more vulnerable when we talk about these issues. So why does the race factor really matter?
So, I mean, I think that we've essentially kind of limped along systems that have historically left people behind. Mm-hmm. That is just a fact. We know that that's happening. Everyone talked about that yesterday in the way that we anchored our passion and the reason why that we're serving. But the reality is that you can use data actually to identify where you have those opportunities at the same time of improving outcomes for everyone.
Sure.
So this isn't a trade-off about whether or not you are going to make someone else's experience in your city worse as you're lifting up another experience. This is the way to communicate that you're going to be making sure that the programs that were designed to solve your problems are actually going to solve your problems. Sure. And I think that there's a tension there. And I think it's okay to talk about that tension, but it's about the experience of living in cities. And this is about communications. It's about the way we talk about data, but it's also about the way that we manage with data and that we let data sort of lead us into making sure that what we're investing in terms of solutioning is actually working.
Well, and good management requires us to look at the nuances that might be present in the data that we are considering, that we're looking at, and that we're using to make the decision. So those nuances are right in the center of disaggregated data. Let's move on and talk about the infrastructure that's actually required. What is the infrastructure that's required to create local and disaggregated data by race?
So this is not a technology challenge. And I think that we all think that we can solve these things by investing a lot of money in technology. And the reality of the situation is this is like a governance issue where you really do just need to create some definitions, some basic definitions on every program in our city will define race this way. We will define gender this way. We will use these standard age bands whenever we're talking about anything that has to do with age this way. And this seems like very low-hanging fruit, easy peasy stuff. But the reality is it's not happening. And because it's not happening, you have no idea actually the collective impact of your investments that are happening across your portfolios. And so a lot of this is just changing the way that we think about and that we demand data to be collected in systems that you're already deeply invested in, that you already own, that are already doing the busy work of collecting data across your enterprise.
So we had a global crisis that some will say we're still in to some degree. And your work was able to sit right at the center of that crisis. Before we get into what the opportunities and limitations of that were, can you just expound a little bit more on the work that you were doing during the pandemic?
Yeah, I mean, I think, the pandemic took a lot of public institutions off guard in terms of your data capacity, right? And so very quickly, cities and states and the federal government had to kind of create data infrastructure. You needed to have people that were sitting right next to you as a mayor who could tell you, where is COVID in my community? Where are testing sites? Where are vaccination sites? And what a lot of public leaders learned was that that didn't exist, that you had to actually build that. And I think that we were found flat-footed when it came to the pandemic. And it was a big teaching moment for why you invest in public data infrastructure. And it was, in some places, expertly executed, where we saw some cities really rise to the occasion, marshaling a lot of resources for collection of that data, states that were now creating intergovernmental data sharing. So you were getting data from your health departments and your state and making sure that that data was flowing so you could support decision making. And in some cases, it fell apart. And that was something certainly that we observed through this global collection of data that we were doing here at Hopkins.
I want you to go a little bit more about the actual tool and what you created. I think we all saw it, we all know it, but I want to make no assumptions. And many of you all were on the stand-up that Bloomberg Philanthropies did simultaneously, where we had calls with mayors across the world who were centering this conversation and use the data platform that you were managing with the team here at Hopkins to make data available to every news outlet, to cities, to states across the world.
Yeah, so it started off kind of very small, where we had a graduate student and engineering professor who had been collecting data on lots of communicable diseases across the landscape of the world, like measles and some of the other communicable diseases. And they were collecting data on this nascent disease that was in China, where the graduate student was from. And it became the authoritative source. In the early days of COVID, it was literally the only place that started collecting all of this data in one place to give you a global view. I don't think any of us who worked on this effort, I came in to design the front end, so the maps and the charts and the graphs, all the data that we shared publicly was part of the work that GovX led. But the reality of the situation was that I don't think any of us thought 3 years later we'd still be the authoritative source in many cases. And so it was a referendum on public data infrastructure, both at the national level, but also at the state and county level, and the capacity of institutions to be able to provide real-time public health data to leaders so that you could make these difficult calls about whether your economy stayed open, whether your schools stayed open, whether or not you were bringing people back into offices. And so, we became a reliable source. I think it's an interesting position for a university to be in, but I think that, we answered a call, and we'll continue to answer the call, but also working with you to kind of prop up these capabilities so that you can rely on your internal data resources to help navigate some of these big challenges.
Sure. And what was a challenge with, what is the ongoing challenge, even with that tool that has now been built and is in place, as you think about race-based data, disaggregated data? What was difficult about that? Can you share a little bit about behind the curtain of what you all were dealing with?
I think when we all started first looking at COVID data, we saw big rolled up numbers of COVID data. You knew where the cases were, you knew the testing data, you knew death data, but you didn't have a real grasp except for anecdotal information that allowed you to understand that, okay, we're hearing that a lot of Black and brown people, particularly in certain regions of the country, were dying at a higher rate. We're coming into the ER at a higher rate with more serious disease, that we're not getting access to kind of the basic public health information that was helping them stay safe in their communities. They were also populating our front line that didn't have the option of working from home. And so we knew this all anecdotally was happening, but there was no actual view of it in the data. When we first started the collection, there were 0 cities or states that were reporting any of that data broken down by race. We started early on to see some case data broken down by race and ethnicity, but it wasn't uniform across any state. And then we put out a lot of messaging from the Hopkins dashboard saying, we must start to see these demographic breakdowns. And then we saw more states starting to use disaggregated race and ethnicity and gender and age data. But the problem was, even within the same states, they weren't using the same definitions.
Sure.
So in a particular state, they could be using a different definition for race, a different definition for ethnicity, a different age bands when they were talking about vaccines, than when they were talking about testing access, or when they were talking about cases, than when they were talking about deaths. And so what it did was it made it almost impossible for you to figure out whether or not your public health interventions were working. Were you actually deploying your mobile units to the right communities? Were you actually thinking about your mitigation strategies in a way that was going to improve health outcomes? The best ways that you knew how to do that early on, that was in the stay-at-home orders or the masking orders, and later on that was in vaccination and getting good public health information out. And without that, we had, in this country alone, in the United States, we have over 3,000 different health commissions that were making decisions during COVID. We had over 1,000 different operating definitions of demographic categories. That's a big problem. That is obscuring a huge amount of actual underserving and underrepresentation of public health effort. And it is a problem that is urgently in need of being fixed.
And this is where the national standard that Denise shared is really, really critical. We've had the same experience even with the Black Wealth Data Center. We have an issue that we are focused on. We have the Racial Wealth Equity Database, which has pulled on over 38 different sources and tried to make them accessible through the click of a button. But even as we were bringing those data sources, those publicly available data sources together in one place, the definitions range widely. If you think about the Black community, what is defined as Black, whether or not that's people who were born in this country or elsewhere, we can go to many other racial groups and ask the exact same question. And so making sure that we have that data in a place that what we are delivering for people and what we're trying to make available is actually communicating the right thing is highly important, and has been a real attention for us as well.
And I want to ask you a little bit about that also, which is that when we're not doing this, we're creating, I think, a much more dangerous situation where the public is not trusting our decision making.
Sure.
Because they don't see themselves reflected in the realities of your messaging. So if you're saying that you've got 80% of the population vaccinated, but you know that you have 60% of the Latino population that's not vaccinated, then they're not going to see themselves in your message, and they're going to distrust then what you're saying.
And the services behind it, and
right?
the interventions behind it.
And so this is directly connected to why politicization was able to sort of take hold in the pandemic. And this is not unique to just pandemic politics. We're seeing this now across all service areas, across all of the kind of big challenges that you're facing, whether that's reductions in crime, whether that's less hungry children, whether that's health outcomes, whatever that is, we're having this big challenge that you're not just being asked to produce the data and to produce the strategy and to hold yourself accountable, but you're being asked to do it in a way that's actually building trust in an era where people are automatically, sort of as a default, not trusting some of the decision making that's happening.
Yeah, this is this question of how do we meet the moment with data, and whether that moment is a big global crisis or whether that moment is something very positive that you're trying to do in your community and really understand it. What do you think is required for mayors to meet that moment in terms of what they should be asking their teams and thinking about to build this infrastructure?
I 100% believe that this is a capacity issue, that this is just about, you've got some of the most preeminent subject matter experts in the world working in your agencies. You have smart planners, you have smart transportation thinkers, you have smart people that are thinking about parks, recreation, all of the things that you're responsible for delivering, but they have not been skilled in data use throughout their careers. Some of them are going to come in with kind of, native data skill, but some of them, are like me and Gen Xers and went to school, and if you got like a class in Excel, you were lucky, but you're certainly not like optimizing caseloads using pivot tables or thinking about kind of basic skills, right? And so there is a capacity issue. And if you don't have those basic skills, you're going to be more hesitant to ask the right questions. So you're not going to want to ask the questions because you're not going to know the solutions. You're not going to know how to answer those questions. And so one of the things that we are going to be working with you on throughout the course of the City Data Alliance is how can we naturally start attracting, but also building and retaining some of these skills in your governments, because your teams are the teams that are going to have to ask these questions, but more importantly, we have to demand that they adhere to these standards and think about the capabilities that will allow you to actually navigate some of this really hard decision making and some of this policy making from the perspective of disaggregated data.
I think on top of what you're saying, we designed the Black Wealth Data Center from the orientation that everyone is not going to be a data expert. That is not a competency that everybody can have a Beth even at their side. And so part of what we were trying to do was to figure out how can we make the data as accessible as possible. Think of the census in the U.S. that, if you are a data expert, you can go to that website and navigate. We wanted to make sure that there were examples and ways with the click of a button, just like Mike talked about with the terminal in the financial industry, with the click of the button, people can start to look at this issue and look at it disaggregated by race. And so I'm hoping that we see not only the tool that we've invested in, but many other tools like this across the world that allow people to access this without even being an expert. But I think most importantly is an orientation to ask the question and not over-rely on the data points that are in front of you that may require us to ask other questions. For example, the reason why we got here is because people keep saying, the Black community in the U.S. has 1/8 of the wealth of the white community. And when we started this work, we said there's a lot of other questions that we need to ask and not just rely on that single data point, right? To get to the why, to get to the intervention, to understand the nuances of that from a national level, but also regional and local, as we think about regional and local economies, we have to ask far more questions. But that's the only data point that most people rely on in this issue. So I think this orientation that we have to require all of us to do is to ask tough questions and ask what else could our data tell us and what other standards do we need in order for our data to work well for us.